Hamilton's McMaster Children's Hospital is appealing to the provincial government for help tonight and says the lives of children are at stake. The hospital says it's facing a growing backlog of children who are forced to wait for the surgeries they need. Al Sweeney has that story.
McMaster is one of 4 children's hospitals facing an expanded wait list for pediatric surgery, along with sick children's in Toronto and hospitals in London and Ottawa. The head of pediatric surgery at McMaster says he never expected anything like the daily list of surgeries he sees waiting.
It's horrific. I don't know what else to say. It really is that bad. It's just, and it's just not ending. And you look at your list and you got to pick from that list to choose who you think needs it the most, and everybody else just waits.
The figures on children's surgical wait times show close to 12,000 children are waiting for surgery across Ontario. More than 2,300 children are waiting for surgery at McMaster, and 69% of those children at Mac, more than 1,600, are waiting longer than clinically recommended times. Dr. Peterson says that wait is dangerous, possibly even deadly.
If I do a surgery on the child, right away, might be one surgery, the quality of life for that child, maybe, 95%, maybe better, like maybe almost perfect. If we get delayed long enough, then that one surgery could change into 2 surgeries. The results are going to be a lot worse. Quality of life could be long-term functional pain implications down the road.
McMaster says the problem started when their staff were overwhelmed by COVID, then flu and RSV respiratory illnesses. Surgeries had to wait, and the waiting list grew. The hospital says it needs more staff in the operating rooms and throughout the hospital. In response, a spokesperson for Health Minister Sylvia Jones says the government has offered hospitals full support to do what we can to ramp up their capacity. She says she'll work with hospitals on permanent investments to increase critical care beds and their facilities. But she gave no details, and the opposition at Queen's Park says it's not good enough.
Frankly, saying to families right now, no, your child badly needs this surgery, but we're not going to spend the money to look after them, that doesn't wash.
If we want to solve this crisis, and parents and children deserve our full attention to solving this crisis, we need to invest in the people who care for our children.
And McMaster's head of pediatric surgery says they don't see any end to this crisis.
I think helpless, hopeless is really, I think, what a lot of us are feeling right now, and the families the same way.
Dr. Peterson says so far no children have died at Mac because they had to wait for surgery. They've been able to move resources around to make sure that doesn't happen, even if it means some other child has to wait. But there are children who've suffered because of the delays.